Hello everyone. Welcome to Ritu's Ascent Rehab and Fitness Center. On this day, which is RA Awareness Day, we are going to discuss about the condition rheumatoid arthritis. It is one of the orthopedic condition which is commonly seen in the women compared to male. The symptoms of the rheumatoid arthritis are the patient complains of pain in bilateral fingers, toes, and the patient may also complain morning stiffness, and there might be a reduction in the movement. Basically, it is a autoimmune disorder. The condition is due to the fight by the body itself, not to the foreign body. When there is an autoimmune condition, the inflammation that occurs in the joints all over the body is by itself, and there might be 2 to 3 joints involved in this condition. Till now, we have discussed about the rheumatoid arthritis and the symptoms. Diagnostic pattern which we include for this condition: rheumatoid arthritis factor and CRP levels, CBP levels, and sometimes X-ray to see the degenerative changes, and there might be a scraping of the bone. So we have to see that. After the diagnostic process, the medication will be given to control the inflammation and to improve the function of joint. We see rheumatoid arthritis in 2 forms, basically, which is diagnosed, and the second one is subclinical rheumatoid arthritis, which is not at all diagnosed in the any blood test or the x-rays or any diagnostic forms. So in the subclinical rheumatoid arthritis, patients complain the same pain as the rheumatoid arthritis, but all the x-rays, all the tests will be negative, and still the patient is complaining pain. And this condition is mainly seen in postpartum period. So women, you need to take care of about this, because the rheumatoid arthritis condition which affected during the postpartum period is misdiagnosed as the normal body pain because of the postpartum. Here we are going to speak particularly about the postpartum. As a postpartum mother, you will be having so many changes in your hormones, and also the sleep deprivation, the vitamin deficiencies, which may aggravate the condition. So the postpartum mother should not neglect this condition or the symptoms that may be experiencing in the daily basis, and I advise to make a proper evaluation so that you get a prior treatment and to prevent the further recurrence of the rheumatoid arthritis condition. There might be flare-ups in the condition, so you have to manage all the time the treatment for both the rheumatoid arthritis conditions, which is diagnosed RA and the subclinical RA. Both are same with few differences. Like in diagnosed RA, we are going to include the physiotherapy and diet and nutrition along with the medications which are prescribed by the orthopedician. And in subclinical, the early treatment which has been taken by the individual shows a perfect improvement instead of leaving the condition as it is. Because if the condition is left like that, it may convert into the complete diagnosed RA with the RA factor positive, including autoimmune changes in the bone. Means there might be a degeneration with scraping of the bone also seen. Coming to the part of diet and nutrition, the care should be taken about the calcium, vitamin D3, and the omega 3 levels in the body. The vitamin D3 and the calcium improves the bone density, and we can avoid the osteoporosis or osteopenia. The omega 3, which we include in our diet, improves the inflammation in the body so that the RA inflammatory factors may reduce, and there might be less bone degeneration or less bony changes with this omega 3. As a physiotherapist, we take more concentration on improving the inflammation and the pain, and also reducing the stiffness and improving the movement of the joint. After this thing, we concentrate mostly on the person's functional activity, which gets disturbed when there is a movement restriction in the both the bilateral joints of hand and along with the toes, or even if the other joints are involved. When the functional activity is improved, we concentrate on the strengthening part of the joint, whichever is involved. Physiotherapy may give a improved lifestyle for your condition. There is no complete cure for the rheumatoid arthritis, but yet we can manage it through the medication and through the diet and physiotherapy. Whenever you are diagnosed with the rheumatoid arthritis, or you are having this kind of symptoms like repeating the same, the bilateral involvement of both the hands, both the fingers, both the toes, or any other joints which are bilaterally involved, means both the sides are involved, along with the morning stiffness and reduced range of motion, which can be stays on 1 to 2 hours continuously in the early mornings. If you experience any of these kinds of symptoms, you just go for the evaluation so that your further condition should not be get worsened. If the early treatment you are included into your daily life, the better will be the improvement later. If not, there might be a severe deformities because of the improper treatments. And the flare ups are common in the winter seasons, rainy seasons, and whenever there is a inflammation in the body. The main thing you have to consider is you should not have a short term treatment plan. You should not have a short term mindset in taking the treatment. You should not stop taking the proper nutrition, proper diet, and proper medication which you are being suggested. If you neglect the condition, there might be the changes in the severity. So the main thing you have to do is follow a basic routine, follow the medication properly, and the exercises which are the most important, which helps in maintaining your movement and the joint flexibility. So on this day, as a part of my role, I have been suggesting you this on the rheumatoid arthritis. If any doubts, if any information you need to ask, you can comment us on the page. We will reply you. If you like the video, like, share, and subscribe, and share with your friends and the family members who are in need. Thank you so much.